I'm not a big number dropping person, but 15 million people struggle with alcohol use disorder, about 5 to 6% of the population. So understanding factors that can contribute to that and some of the underlying behavioral and brain systems that may play a role in addiction may eventually lead to better treatment programs and help for people that are struggling with substance use disorders. The research questions that I'm interested in tie into addiction and in particular drug-seeking behavior and why people sometimes struggle with seeking out drugs and it may be a critical factor that leads to kind of the cycle of addiction continuing. The theory that we really test and evaluate is a theory that's been around since the late 90s and early 2000s. It's the incentive sensitization theory of drug addiction, and at a very simple level, it really says a learning process occurs where drugs and drug states are paired with cues in the environment, and over time those cues become capable of motivating the drug-seeking behavior. And so, as many in psychology know about Pavlov and salivating dogs, there's the potential for drug cues that are paired with drug states to come to generate drug-seeking behavior on part of the drug user, and it's part of the questions that we ask in our lab. And I collaborated with people at OHSU and Behavioral Neuroscience to ask those questions during a recent sabbatical. It can be a lot of different cues. It could be visual, auditory, touch, and in fact some of the research that we do on drug-seeking behavior using mice that are inbred and models of alcohol drug-seeking behavior. The cues we actually use are touch cues, or tactile cues. But the cues can vary depending on the lab that you work in. When you explore some of these questions, they can be specific visual, touch, auditory, smell cues, olfactory in nature, or they can be general contextual cues that are like a combination of many of those kind of primary sensory cues. And many of these theories that are being used to explain drug addiction are now being applied in issues related to obesity and intake-related problems and the power of environmental cues to trigger consumatory behaviors and maybe contribute to obesity as well. So the research that we did up at Oregon Health Sciences University in the Behavioral Neuroscience department was part of an investigator there, Chris Cunningham's lab work, and he spent his career really studying alcohol use and abuse and modeling that most lately using mouse models of alcohol-seeking behavior. And the work we did involved a technique called place conditioning. And in place conditioning, an environmental cue, like a tactile cue, can be paired with a drug state, and in this case, alcohol. And another similar environmental cue in place conditioning, another tactile cue that they can discriminate, is actually paired with saline solution. Over an 8-day period, animals on half of the days will get alcohol paired with one of the tactile cues, say a whole floor, and on the other 4 days they'll get saline paired with a grid floor, a different tactile cue. And being good experimentalists and scientists, we counterbalance that, so half the animals get the drug paired with the grid. But the important thing is only after 4 alcohol exposures, these DBA2J mice, when they're tested for a preference for the place that had been paired with alcohol, they show very strong what we call alcohol-induced conditioned place preference. And they spend a lot of time on the cue that had been paired with the alcohol. And it's just with 4 alcohol exposures across an 8-day period that learning process puts in place this association that now governs their behavior. They are guided by this cue and seek out the place that had been paired with the drug. But the real exciting thing that I did on sabbatical was we pursued some really interesting questions related to opiates and opioids. And of course, we can't live in society without seeing the concerns and challenges in our world with opiate use and abuse. And one of the interesting things that we've known about for some time is that you can hasten the extinction of what they've learned about with alcohol if you give them a drug that blocks or reduces opiate activity in the brain. And it's a drug called naloxone. And the lab that I'm working in the early 2000s did really nice research showing that they begin to show weakened conditioned place preferences when repeatedly exposed to that place that had been paired with the drug. But you hasten that weakening if you give them naloxone prior to those tests. And today we know that some people that struggle with alcohol use and abuse, naloxone can be very effective for some of them in reducing their wanting and craving for the drug. The fascinating thing that we didn't know is what would happen if instead of giving a drug that would block opiate activity, what if we gave them a drug that elevates opiate activity? And a classic drug that you could look at, and we did in our case, was morphine. We trained the animals to show very strong alcohol-induced conditioned place preferences, and then took them through kind of the drug rehab phase where we repeatedly exposed them to the cue, and we saw weakening of that learned drug-seeking response. So it appeared that the incentive salience was weakening a bit. For other groups of animals that went through the same process, we gave them morphine prior to their test. And what stunned us was the alcohol-induced conditioned place preferences were enhanced by the presence of morphine in their system. As we do in our fancy little experiments in psychology, we did the extinction for 4 days, and when they had the morphine in their system, they showed really strong alcohol-seeking or cue associated with alcohol-seeking behavior. And then on the 5th day, we almost were questioning, is this real? And so we didn't give them the morphine. And what we saw is the animals that had been getting morphine, they were showing extinction of the response. On that 5th day, their cue seeking for the place that had been paired with alcohol went down to the level of those animals that had never received morphine during extinction, which was fascinating. So we decided to do a 6th day and bring the morphine back, and boop, it goes right back up. And so that presence of morphine in the system seems to be making that cue that had been paired with alcohol definitely something they seek and potentially more desirable.